I think a lot of times it can really help people relax, medical cannabis can, as well as sometimes feel sleepy. Now, the issue with medical cannabis, though, is a little bit is very helpful for some of these, for certain patients. But keep in mind, too, that if there's massive amounts of THC, cannabis can actually be harmful for patients' anxiety symptoms. I think people need to ask about how quickly products work, how long products work, and how much they should take and how often. Having those constraints around some of the products really do take some of the guesswork out, and they really take more of a medical approach to knowing how much to take and when for each patient. I think that cannabis can be a very helpful agent for anxiety, especially one that can be used as needed. So I think that the mainstays of anxiety treatment are generally chronic in nature, and we have really good meds that help that, but sometimes there still is anxiety that peeks through. And so whether someone chooses to use cannabis chronically to treat that, I think a really good niche for it is its as needed ability where patients can choose to utilize it when their anxiety spikes. The biggest challenge when using medical cannabis for anxiety is the dose. I think a little bit is very helpful, but too much can be really detrimental and actually worsen anxiety. And so I think if somebody's very naive and they don't know, finding the dose could be really challenging. I think it becomes much more easy as somebody is more comfortable with cannabis use over time. I think anxiety is very crucial to cannabis research because a lot of medical cannabis use is around anxiety, but a lot of it is used anecdotally. And because there is a spectrum of dosing with cannabis products that can either help anxiety or make it worse, more research is really helpful in determining which population is medical cannabis going to be most beneficial at which dose.